Good evening and welcome. Let's start with this bulletin with bringing you some updates from the United States. The states in the U.S. are slowly reopening, even as the country records nearly 77,000 deaths from COVID-19. But now reports suggest that the Trump administration buried a detailed guideline on how to reopen the country by the nation's top federal agency. Now, the 17-page report by Centers for Disease Control and Prevention, or the CDC team, was not even published. So what is this report that the White House did not want anyone to see? The report talked about guidelines and measures on how to open up the country again. Since the beginning of the pandemic, the Trump administration has been controlling the release of information with respect to the outbreak. Traditionally, this has been the role of the CDC, especially during a public health crisis. Even CDC Director Robert Redfield has been missing from public appearances. Meanwhile, U.S. President Donald Trump and Vice President Mike Pence have tested negative for COVID-19. This comes after a member of the U.S. military who works at the White House as a valet was found infected with COVID-19. But even with this scare, neither Trump nor Pence were seen wearing masks in an Oval Office meeting. But even as the United States takes steps to reopen its economy, House Speaker Nancy Pelosi has laid out broad outlines of the next coronavirus aid bill. The bill will majorly focus on three aspects: additional aid to state and local governments, more money for coronavirus testing, and, as she said, putting money into people's pockets.
Honor our heroes, state and local. Open up government, testing, science. That's the key to opening up government. And third, putting money in the pockets of the American people. And again, the heartache that is out there.
Meanwhile, in a latest move, the U.S. military has banned anyone with COVID-19 from enlisting into the Army. There will also be a new guidance for examining an applicant's history with the disease during the screening process. However, the move comes only as interim guidance until more is known about the damage that the virus does to the lungs.